we
Ya cerca
can
de
have the rest of
60,
the
70
people
personas
that
ingresando.
want to
Entonces,
join
les
us
pedimos un
and
poquito de
to
paciencia
actually
para
do. So just
arrancar el
let's
día
be
de
a
hoy.
little
En un minutito más,
patient so we can start.
iniciamos. Muchísimas gracias.
Thank you so much.
Muy buenos días para todos y para todas. En nombre de la
Good morning,
Organización
everybody.
Panamericana de
On
la Salud,
behalf of
WSOMS,
PAHO
es
and
un honor
WHO,
darles la más
it is
cordial
a
bienvenida
pleasure
al
to welcome
seminario
you to
web
this
titulado Fuerzas
webinar
de Trabajo en Salud
called
y la Inteligencia Artificial, Visión
Health
Estratégica
Workforce
en
and
la
Artificial
Región.
Intelligence,
Mi
Strategic
nombre es
Perspective
Joana
in the
Díaz
region.
Rivalle, soy
I
asesora
am
regional de la Unidad
Johanna
de Recursos
Diaz
Humanos para
Rivalle.
la
I'm
Salud
the
del
consultant in the
Departamento de
region
Sistemas de
for
Servicios de Salud
PAHO
de
from the Department
OPS
of
con sede
Services,
en
PAHO,
Washington.
and
El día de
WHO,
hoy nos complace
posted in
contar
Washington.
con la participación de
Today,
autoridades
we
sanitarias,
are
expertas y
glad to have with
expertos
us the
de nuestra
participation of
región,
experts in healthcare in our region,
representantes de ministerios de salud,
representatives of
instituciones académicas,
ministries of
organismos
health,
internacionales y
academic
asociaciones
institutions,
profesionales,
international
quienes nos
agencies, and
acompañan
professional
desde
associations
distintos
who are
países de
with
la
us
región de las
from several
Américas.
countries of the
También
Americas.
queremos enviarle un
We
cordial y
also
caluroso
want
saludo
to send
desde la Unidad de
warm
Recursos Humanos
greetings
para la
from the
Salud a
human
las y los
resources
profesionales y
to the
estudiantes
work
de
halls,
los 33
to the
países de la
health
región
workforce
que
for the 36
participaron con
countries in the region
nosotros
who were with us
y que se están uniendo el día de hoy con
and that
nosotros en
are
este
joining
evento.
us
Su
today at this
participación
event.
sin duda
Your
refleja el
participation
compromiso
certainly
regional y el
shows the
interés por
original
fortalecer
commitment and the
las
interest for
competencias del
strengthening
personal
the
de salud
competences
en el
of the
contexto de la
health
transformación digital.
workforce in the context
Quisiera
of digital
recordarles,
transformation.
colegas, que
I would
tenemos
like to
interpretación
remind you all
simultánea
that
en
we have
inglés, en español y
simultaneous
en portugués
interpretation in
para
English,
facilitar la
Spanish, and
participación de
Portuguese.
todos
That way
nosotros.
we
Así
can
que por favor, en la
facilitate
parte
everybody's
inferior
participation.
de su
So
pantalla pueden
at the
localizar un
lower
icono
part
en forma de
of
mundo
your
que
screen, you
les
can
permitirá
find a globe
seleccionar el idioma
icon
en
that
el que
will
ustedes se
allow you
sientan
to select the
más
language
cómodos.
you feel the most
Hoy nos
comfortable in.
reunimos para reflexionar
So
sobre
today
cómo
we
la
are gathering
inteligencia
here to
artificial
reflect
puede
on how
apoyarnos en el
artificial
desarrollo de
intelligence
distintas
can help us in
actividades
the
y
development of
específicamente
several
contribuir al
activities, and
fortalecimiento
most
de la
specifically
planificación,
to
formación y
contribute to
prácticas
planning,
profesional
training, and
de la
professional
fuerza laboral
practice
en salud,
of the health
a través
workforce
de una transformación
through
ética,
a
equitativa y
ethic,
centrada en las personas.
equitative, and
Please let me switch to
person-focused
English.
experience.
It's
And
now
now,
my distinct honor to invite Dr. Mary Lou Valdez, Deputy Director of PAHO, who to deliver the opening remarks for this important seminar. Dr. Valdez, the floor is yours.
Thank you, Ms. Diaz. I really appreciate it. Good morning, everyone. It is my honor to greet our panelists, our experts, and all of the participants that are joining us today from across the region. We are at a historic moment for the health of the Americas. Artificial intelligence no longer belongs to the future of our health workforce. It is here and it is now. The present and future discussions and actions on artificial intelligence will determine whether it becomes a tool for equity or a factor of exclusion. Here at PAHO, we understand that this technological revolution must be directed toward improving the health of the populations that we serve. And that means placing it at the service of our most valuable asset, our healthcare workers. The policy of the Health Workforce 2030, which was adopted by PAHO member states in 2023, sets out a clear vision, and that is to build a resilient health systems with a sufficient, well-trained, and equitably distributed workforce. This policy emphasizes the need to strengthen governance and promote policies and plans for human resources for health that bolster planning, information systems, and curriculum development based on science, evidence, and innovation. The strategic line incorporates the digital transformation of the health sector, laying the groundwork for integrating emerging tools such as artificial intelligence into management and training of the health workforce. Artificial intelligence can be a catalyst to achieve our goals for the health workforce, but only if we act strategically. Please allow me to highlight 3 key dimensions. The first is education and training. According to the study conducted by PAHO, which results will be presented during this webinar, 8 out of 10 health professionals in Latin America and the Caribbean have already used some form of AI as a tool, yet only 1 in 10 has received formal training in its use. Artificial intelligence is transforming the way we prepare health professionals. Intelligent simulators that allow safe practice, adaptive systems that personalize learning according to individual needs, and educators who become facilitators of critical thinking and the human-centered competencies that no machine can replace. AI can also democratize access to education. A student in a rural area can access high-quality learning resources comparable to those available in urban settings, breaking long-standing barriers of inequity. The second dimension is clinical practice. Again, per PAHO's study, 68% of participants believe that AI can improve efficiency and productivity. 55 think it can enhance the quality of care delivered, and 57 believe it can reduce workload and personal burnout. Health personnel face an administrative overload that takes away time from providing quality care. AI can automate repetitive tasks, help to support diagnosis, and predict care needs. It does not replace the professional, but it frees them to do what only a human being can do, and that is have the time to listen carefully to the patient and decide with empathy and expertise the best care needed. Let us imagine professionals with more time for direct patient interaction, with immediate access to specialized second opinions through AI, and health managers using it to calculate and estimate the numbers and types of professionals needed in health systems. This is a tangible promise of artificial intelligence. And the third dimension is regulation and ethics. 6 out of 10 professionals perceive that current governance and regulation is insufficient. More than 50% express concern about ethics and data protection. And 58% believe AI projects should be evaluated with the same rigor as pharmaceutical products. Our responsibility as public health leaders is crucial in this matter. Artificial intelligence must be developed under strong ethical frameworks that ensure privacy, equity, and transparency. We cannot allow algorithms to perpetuate biases or widen existing gaps. We need harmonized regulations that protect both health workers and users, ensuring that AI serves as a validated and safe clinical support tool. Moreover, we must include mandatory training in digital literacy for all health professionals at all levels, from our students to health specialists. Colleagues, the question is not whether AI will inform the health workforce, but how it will do so. Will it be an inclusive and empowering transformation, or will it expand inequalities? At PAHO, we are generating region-specific evidence on the impact of AI on our health workforce. This evidence will guide public policies, strengthen governance, and support evidence-based decisions and actions. The solutions and the pathways forward are in our hands. This webinar is an incredibly important opportunity to begin to collaboratively shape the future of health in the Americas, with human intelligence enhanced by artificial intelligence, and always in the service of our shared mission, which is health for all. So thank you very much for joining us today, and welcome to what will be a truly transformative discussion. Thank you, and back over to you, Johanna.
Thank you very much, Dr. Valdez, for your inspiring remarks and for highlighting PAHO's commitment to strengthen the health workforce, advancing the digital transformation of the sector. Thank you very much. Ahora, nuevamente, colegas, quiero dar la bienvenida
Once again,
a quienes
colleagues,
están
now I
uniendo a
want to
esta
welcome those
actividad.
of you who are
Ya estamos
joining us during this
rebasando
activity.
los 420
We have already gone
participantes.
above
Nos emociona tenerle a todos
420
ustedes acá con
attendees, and we're
nosotros.
very
Y
excited to
ahora
have
nos
you
vamos a
with
mover
us
al siguiente
today.
punto de la
And now we're
agenda.
going to
Vamos a
move to the
escuchar la
next
presentación
item
de
of
los
our
resultados del
agenda
estudio
with the
sobre el impacto de
presentation
la
of the
inteligencia
study
artificial en
results
el
on the impact
desarrollo
of
y
artificial intelligence
fortalecimiento
in the
de los recursos
development
humanos para
and
la salud
strengthening
en
of human
América
resources
Latina y el
for
Caribe,
healthcare in Latin America
liderado
and the
por la Unidad de
Caribbean,
Recursos Humanos.
led by
Nos
the Unit of
acompaña
Human
el
Resources.
doctor
And with us
Benjamín
today, we
Puertas,
have
jefe de la
Dr.
Unidad de
Benjamin
Recursos
Puertas, who is
Humanos
the
para la
Chief of the
Salud,
Human Resources Unit
y
for
la doctora
the
Natalia
healthcare
Rodríguez,
workforce,
consultora
and Dr. Natalia
internacional
Rodriguez, who's an
de
international
la Unidad de
consultant
Recursos Humanos
of
para
the
la Salud
Human
también en el
Resources Unit
Departamento de
for
Sistemas y Servicios de
Healthcare
Salud,
and the
quienes
Department of
compartirán
Systems
con
and
nosotros los
Services
principales
in
hallazgos
Healthcare,
y
who will share with us
recomendaciones
the
de
most
este
important
interesante
findings
estudio.
and recommendations of this
Doctor
very
Puertas,
important
doctora
study.
Rodríguez,
Dr.
bienvenidos.
Puertas,
Adelante,
Dr.
por favor.
Rodriguez, welcome and go ahead.
Muchísimas gracias, doctora Díaz,
Thank you,
y
Dr.
un
Diaz.
saludo cordial. Como
And
decía Johanna, ya
warm
tenemos casi
greetings, as Johanna
450
said. We
personas.
have almost
Y
450 people with us.
mientras aparece
So
la
while
presentación, para
we
nosotros es
have
un
our
gusto
presentation
que
being
luego de
shared,
un año de un
it
trabajo
is very nice
intenso
for us that
que inicia
after
con
1 year of
buscar
intense work that starts
entender
by trying
cómo el
to
personal de
find and
salud, la fuerza de
understand
trabajo de salud
how the
de nuestra
healthcare
región
workforce in
está
our
siendo
region
impactada
is
por el
being
desarrollo de la inteligencia
impacted by the
artificial.
development of
Y cómo esto
artificial
puede convertirse, como
intelligence, and
bien
how
decía la
this
doctora
can become,
Valdés,
as
en un
Dr. Valdez
elemento de
had said,
fortalecimiento,
in an
pero
element
aplicando con
of
mucho cuidado el
strengthening,
tema de
but
equidad
also looking
en
very
cuanto
carefully on
al
the equity
acceso a esta
factor in
nueva
terms of access
herramienta de
to this
tecnología
new
digital.
technology tool, this new
Vamos a
digital
iniciar
technology
entonces
tool.
con los resultados de
Now,
este
we're going
estudio
to
que
start with the
involucró a
results of this study,
muchos
which
países de la región. Los detalles los
involved
vamos a
several
hablar.
countries in
Una
the region. We'll
muestra que
give you
empezó
details
siendo
further
calculada en
on. A
900 y
sample that
casi llegó
started
a
being
ser 3.000
calculated in
personas,
900 and almost
médicos,
reached
enfermeras,
3,000 people.
odontólogos,
Doctors,
promotores,
nurses, dentists,
profesionales de la salud de nuestra
consultants, all
región.
kinds of
La
professionals in
siguiente.
healthcare in our
Y
region.
luego de plantear el
And
porqué
so,
del estudio,
after
nosotros
having
quisimos
established the
identificar
reasons for this
y
study,
estimar ese
we
impacto de la
wanted to
inteligencia
quantify and
artificial en el
estimate that
desarrollo y
impact of
fortalecimiento de los
artificial
recursos humanos
intelligence
en
and the
salud en
strengthening
Latinoamérica y el
of
Caribe. Hay
healthcare
mucha
workforce
información
in Latin
que
America and the
está
Caribbean. And
apareciendo
there's a
día
lot
a
of
día en
information
los
that
periódicos, las
is
redes
constantly
sociales, a
coming
través de la
up in
influencia
the
y el impacto
newspapers
que tiene la
and
inteligencia
the social
artificial, pero
media
nosotros
about the
queríamos saber en
impact AI
particular cómo
has.
es este
But
impacto
we
en nuestra
specifically wanted to
Latinoamérica
know
y en el Caribe.
how is this
Voy
impact
a
in Latin America and the
continuar entonces, ahora
Caribbean.
vamos a hacer una presentación muy
And so
breve de la
we're going to show
metodología
you a very
y
short
luego
presentation of the
centrarnos un poquito en el
methodology and
siguiente
then
slide, en los
look a little bit
resultados,
on the
para
results
luego pasar
to
a
then
analizar las
move
conclusiones, las
to the
recomendaciones y
conclusions,
también algo muy importante, porque este
recommendations,
estudio, como bien
and
decía
also
la
something
doctora
very
Valdés, no se
important,
queda
because
aquí,
just as Dr. Valdez
sino que es
said,
el inicio
this
de
study
una
is not
serie
just going to stop
de
there.
pasos siguientes
It's
que les
going
voy
to
a
go
mencionar al
into the
final.
next
Así es
steps
que
as
iniciamos
well
con la
that I'll mention
metodología
at
y
the
le
end.
doy
So
paso
let's start
a
with
la
the
doctora
methodology, and I'll
Natalia
allow the
Rodríguez,
floor
que va a hacer
for
la
Dr.
presentación de
Natalia
esta parte
Rodriguez,
y de
who
los
is going to
resultados.
present this
Adelante.
part and the results
Gracias,
as well.
doctor Puertas.
Thank you,
Hicimos
Dr.
un
Puertas.
estudio transversal
So we
analítico
conducted an
multipaís de
analytic,
salud
multi-country,
postestructurada de 46
cross-sectional
preguntas con 6
analysis with
secciones.
46
La
questions
unidad de
and 6
análisis fue la oferta de
sections, and the
trabajo en
analysis
salud,
unit
tanto en
was
proceso
the
de
healthcare
formación como en
workforce,
ejercicio de su
both in
profesión
training as
de los
well as the
73 países de
and the
América
exercise
Latina
of
y
the
el Caribe.
profession, and
Usamos un
all the
muestreo
countries
no
of Latin America and the
probabilístico, no
Caribbean with a
ORL, en un enfoque
non-probabilistic with
mixto, con
snowball
una estimación
study with a
muestral de
mixed approach and an
906
estimated
encuestas
sample of
calculadas
906
a
surveys
partir del
that were
total de
calculated
pares
from the total
de profesionales sanitarios de
by
las categorías reportadas al portal
professionals in
de cuentas
healthcare according to the
nacionales del
categories
personal de
and the
salud de la
website
OMS, ¿de acuerdo?
according to the
Las recomendaciones fueron
WHO
validadas con con expertos de los
workforce
países
total with
seleccionados. Más
experts
adelante
of the
les vamos a
countries that were selected and that we will tell you
Entonces,
later on.
¿qué encontramos?
So what is
Con
it that we found?
2.619
With
participantes
over
de la región y
2,600
teniendo en cuenta el
participants
tamaño
in
de
the
muestras
region and
estimados,
considering the
alcanzamos
size
un
of estimated
cumplimiento
sample,
global
we
del
were able to globally fulfill
289%. Los
289%
mayores
of
niveles
what
de
we were
cumplimiento
calculating.
los
The
observamos en
highest
Bolivia,
levels of
Guatemala,
compliance were
Guyana,
found in Bolivia,
Surinam,
Guatemala,
Paraguay, El
Guyana, Suriname,
Salvador,
Paraguay,
República
El Salvador,
Dominicana y Honduras,
Dominican
con
Republic, and
valores
Honduras,
superiores
with
al
higher
1000%
values
respecto a la
than more than
estimación hecha por cada uno de estos países.
1,000%, according to the estimate done for each of
En el
these
gráfico de la
countries.
izquierda, ustedes
On the
pueden
left side
observar que
chart, you
tuvimos
can
mayor
find that
participación
we
de
had
mujeres en el
most
estudio. No
participation of
obstante, la
women in this
distribución
study.
etaria fue
However,
similar entre
the
hombres y
age
mujeres,
distribution was similar
teniendo una
between men and
mediana de
women,
edad de
having a
36 años en
median
el
of
estudio.
36
En el
years old
gráfico
in
de la
terms of
derecha,
age in this study.
pueden
And on the
observar que
right
el
side, you can
70%
find
de
that
los participantes
70%
fueron
of
trabajadores de la
participants
salud.
were
Y este cero
health
es
workforce. And this
significativamente
were
mayor en los
significantly
estudiantes,
higher than
quienes
students
tuvieron una
who
mediana
had
de
an
24 años y la
age
mayoría eran menores de
media of
35
24
años,
years old, and
mientras que
most
los
were
trabajadores de
under
la salud
35 years
estuvieron
old, while
concentrados en los grupos de
healthcare
mayor edad con una
professionals
mediana de
were
42 años. No
having a
tuvimos
median of
diferencia
42 years
según
old. So we didn't have any
la
differences
gráfica
in
de la
terms of
izquierda,
gender.
ustedes pueden observar la
On the
diferencia
left side
clara en
chart,
la
you can find a
composición
clear
académica
difference
de
on
la
the
muestra
distribution, the academic
académica y
distribution of the
profesional de la
sample.
muestra. Los
Also the
estudiantes
professional
estuvieron
distribution of the
compuestos
sample.
principalmente por estudiantes de
Students were
medicina con un
mostly medicine
70%,
students with a
mientras que los
70%,
trabajadores de
while
la salud evidenciaron
professional
una distribución
workers
más equilibrada
found a
con
more
el grupo de
balanced
enfermería,
distribution with between
23%,
nurses
perdón,
and a
35%,
35%,
medicina 33%,
medicine
y es importante
33%.
destacar
And
la
it is important
representación
to
de otras
highlight the
profesiones
representation of
sanitarias
other healthcare
con el
professions
23%,
with
¿de
a
acuerdo? En la
26%.
derecha
On
evidenciamos
the right,
que la atención
we
clínica,
can see
especialmente
that
servicios de atención
clinical
primaria y
care,
terciaria,
particularly primary and
concentraron la mayor
third level
participación tanto en
care,
trabajadores de la
focus
salud
most
como en
participation
estudiantes.
of
Sin embargo, se observó
healthcare
una
professionals
sustancial
and students,
presencia de
but there
áreas
was an
como la
important
docencia,
presence
la
of
gestión y la salud pública.
academics, management, and
Evidenciamos
public
también que el
health as well.
79%
We
de los
also found that
participantes realizan
79%
su
of
actividad
participants
principal en
have
una
their most
institución de
important
naturaleza
activity
pública.
in a public setting.
Respecto al uso y conocimiento de herramientas de
In regards
inteligencia
to the
artificial,
use and
en la
knowledge
gráfica de
of
abajo
AI
pueden
tools, at
observar
the
que
bottom chart, you can
81%
find
del
that
personal de salud
81%
entrevistado
of the healthcare
reportó usar alguna
professionals
herramienta de
interviewed
inteligencia artificial.
have reported the
Evidenciamos
use of
mayor
some
uso en
kind
los
of AI
estudiantes
tool,
respecto a los
mostly in
trabajadores de la
students,
salud.
um,
Asimismo,
than
cuando
in the actual
indagamos si ha
professionals.
recibido
Also,
algún
when we
entrenamiento
asked if they
formal
had
en
received some
herramientas de
kind of formal
inteligencia
training
artificial,
in AI tools,
únicamente el
only
13% mencionaron
13%
haberlo recibido.
have
Este
mentioned
es uno de los
having received it.
indicadores
This
que
is
se
one of
destacan
the indicators
como
that
brecha a las
outstands as a
competencias
gap in terms
recibidas.
of
¿De
the
acuerdo?
competences
También
that we've identified.
evidenciamos que los
We also
encuestados
found
reportaron
that
haber recibido
the
los encuestados que reportaron
the
haber recibido
surveyed
entrenamiento formal
audience who
presentan
received
casi
formal
5 veces
training
mayor
show
probabilidad
almost
de
5
usar
times
herramientas de
most
inteligencia artificial.
probability to
En el mapa de
be
la izquierda
using AI
observamos
tools.
la
On
familiaridad
the
con la
left side
inteligencia
map, we
artificial.
find
La
familiarity
mayoría de
with
la
artificial
región reportó
intelligence.
familiaridad
Most of the
baja,
region
este fue el
had shown to
45%,
have a
únicamente el
low
19%
familiarity, um,
reportó alta familiaridad.
with
Pero
a
vemos una
45%
brecha
and a high familiarity only with 19%. But the gap in the regions
En
is
el
mostly
mapa
with
de
the
la derecha
non-Latin
observamos
Caribbean. On the
el
right
uso de
side map,
inteligencia
we use the
artificial
use of artificial
eh,
intelligence
con el 54% del
with
personal de salud
54% of the
reportando
healthcare
uso bajo.
professionals having shown
Cuando
a low
evaluamos
use of
si los
them.
estudiantes
So when we
están
assess whether the
superiormente
students
usando
are
inteligencia
using
artificial,
AI
evidenciamos que ser
the
estudiante
most, we found that
da
being a
31
student
veces más de
gives you
probabilidad de
31
reportar uso
times
alto
more
de inteligencia
probabilities to be
artificial.
using
Cuando indagamos
artificial intelligence the
específicamente
most. When we
respecto a
specifically asked
herramientas de
about
inteligencia artificial,
artificial
ustedes
intelligence
pueden,
tools per
para
se,
que puedan verlo, el
you
gráfico
can see,
tiene,
well, I
es
expect you're
bastante
able to
grande porque
see it.
preguntamos por 28
And we have
herramientas de
a lot
inteligencia
of info
artificial.
in this
La
chart because we
conclusión general
asked
con esta
for
gráfica es que
28
el
tools. And the
conocimiento
conclusion here
supera
is
al
that
uso.
knowledge is
Encontramos
a
una
lot
diferencia
more than the
marcada
actual
entre el
use,
conocimiento
with
y
the
el uso
important
real de
use
diversas
between
herramientas de
important difference between the use and the knowledge of it. So the important gap between the concept and the implementation is important here. It is also important to highlight that generative AI is leading both the knowledge and the use. It is also important to highlight that the second most important category says here, note. This shows that an important number of our participants are not yet familiar with artificial intelligence, and we found that advanced tools like, for instance, the census analysis, epidemiological, synthetic data, and pharmacogenomics are showing pretty low numbers in knowledge and use. In terms of the boundaries that they find, our respondents had established that the insufficiency in the budget allocation seems to be the most important boundary with over 1,000 answers, and they have scored this as a big obstacle. Low digital competences in both decision makers and the workforce are amongst the most important limitations. Factors such as the lack of political will, interpretability that is insufficient in a region, and the scarce regulation in the use of artificial intelligence seem to be also important obstacles. In terms of opportunities to apply artificial intelligence, our respondents have highlighted that what they see is that it's very likely that AI may improve the efficiency in healthcare, that it may reduce cost and increase quality of services provided. In that same line, 66% of our workforce had said they've incorporated AI in their study or in their performance at work. But when we talk about the future, 64% are forecasting to use it in the future, while 51% thinks that artificial intelligence will give support to healthcare workforce to provide also more tools to facilitate their performance. Lastly, when we assess the perception of risk and the incorporation of artificial intelligence in the sector, the respondents were able to show that 59% are feeling that there isn't sufficient governance and current standardization in the use. 53% say that these projects need to be, 58% feel that these projects need to be authorized and assessed as well as pharmaceutical products, and 53% are expressing concern for ethical issues and data protection. And most don't think that it's likely that artificial intelligence may displace employments, but they do fear inequalities in access to training and new ethical dilemmas. In terms of our limitations, and as we've said, we already had a non-probabilistic Ball-Snow sampling that implies a bias to those that have the least access or those that have the closest approach to initial networks. And so the answers, the rate of respondents was an overrepresentation and underrepresentation in the case of one country that did not complete its sampling. But we also identified that there was an occupational bias because, as you noticed, 70% of the sample were healthcare workforce. Hence, all analyses need to be observed as regional and sub-regional in such a way that a representative estimation is considered per country. As conclusions, we found that the human workforce in healthcare have analyzed the use of AI tools in the sector of Latin America, being conditioned by demographic, academic, and previous experience factors. Youngest professionals with a higher academic level and more economic access have a higher access to them. There are still regional gaps, particularly within non-Latin Caribbean. And so all these findings highlight the need to strengthen institutional and training capabilities in the region. Also, the results have shown that the incorporation of artificial intelligence in academic and work settings depends on the prior experience of the reliance they have and the access to training they have in terms of artificial intelligence. So, Dr. Portas, you may
Vamos con las
continue.
recomendaciones y muchísimas gracias a la
Let's
doctora
move
Lu.
with the
Creo
recommendations.
que
Thank you,
los
Dr.
resultados,
Rodriguez.
como ustedes han
I
podido
think
ver,
that the results,
nos muestran una
as you have
situación muy,
seen,
muy
are
interesante
showing
para
a
seguir
very, very
continuando con
interesting
este análisis. La
situation to
siguiente.
continue with this
Mientras tanto,
analysis.
tenemos que
In the
ir
meantime,
mirando,
we have to keep on
como
looking
decía, recomendaciones y siguientes pasos.
at the
En cuanto
next
a la primera
steps and the
recomendación,
recommendations. In terms of
vamos a
the
ver,
first
las
recommendation,
recomendaciones están,
we'll
vienen
find that
juntamente con
recommendations come together
indicadores para
with
medirlas,
indicators
y ese
to
fue
be
el
able
trabajo con
to
los
measure
expertos de
them,
los
which was
países
the work done
seleccionados
with
que
the
les
experts
comentaba,
of the
que
countries
validaron las recomendaciones del
selected that
equipo de la
validated
unidad.
the recommendations
La primera
of the
tiene que ver con
unit's team.
fortalecer las
And the first one
competencias,
has to
ustedes
do
escucharon por
with
parte de Natalia,
strengthening
para la era digital,
the
integrando
skills for the
contenidos
digital
en Internet
era,
como herramienta
bringing
en la
contents on
formación y
AI
desarrollo
as tools in
profesional. Ojo, aquí son
training
dos
and
elementos.
professional
Uno, la
development. And
formación
this is
y
two
otro, el
different
desarrollo
elements. One is
profesional, la
training,
educación
and the other
continua,
one
la
is
educación
professional
formal.
development,
Pero la
continuous
formación es clave.
education, education for life.
Y
But then
vemos entre
training is
los
key.
indicadores del número de
And we see that
instituciones
among the
académicas
indicators, we have a
que
number
tienen
of
programas
academic
con
institutions
contenido de
that do
IA,
have programs with AI
instituciones
contents,
que tienen módulos,
institutions that
docentes formados,
actually
que quizás
have
es un tema que
modules and
cada vez es más difícil
trained
ir a la par
teachers that
del desarrollo
something that
de la
makes it
inteligencia
more
artificial y de la
difficult
salud
to
digital en
go
general.
at the speed of
Siguiente.
artificial intelligence
También
and in
desde la
its
perspectiva de
influence in healthcare in
recomendaciones,
general.
fortalecer los
Also,
programas
to
de capacitación en
strengthen
servicio. Esto no, no es
training
la
programs in
formación
terms of service
académica,
of
sino la
the human
capacitación
resource,
en
not only our
servicios,
academic
incorporando
training,
contenidos
but
sobre
academic
herramientas
training
de
and
inteligencia
services,
artificial y
bringing
transformación
along
digital, y el
AI
indicador
tools
que va de la
and
mano
digital transformation and the
con esta
indicator that
recomendación.
comes along with
La
this
tercera
recommendation.
recomendación tiene
The
que
third
ver con
recommendation has to do
crear, consolidar y evaluar
with
comunidades de
creating,
práctica sobre
consolidating, and
herramientas de
evaluating
inteligencia artificial en
communities of
salud orientadas
practice
al
about
fortalecimiento de
tools in
recursos humanos.
AI
Aquí
and
están
healthcare,
una serie de
much
indicadores que
oriented to the
tienen que ver con
strengthening of
el
that
número de países que
workforce. And
tienen
here we have the
redes,
indicators that have to do with the number
comunidades
of
de
countries that have
práctica, número
networks,
de participantes,
communities of
productos
practice,
desarrollados por
number
estas
of
comunidades de
participants, and the
práctica,
products
como los
developed by
indicadores
these
que
communities
estarían
of practice
impulsando
as
esta
indicators that
recomendación
will
en los
be
países. La
encouraging this
siguiente
recommendation for the countries.
recomendación
The next
es formular
recommendation
e
is
implementar
to
marcos éticos,
formulate and
nacionales
implement
e
national
institucionales que
and
orienten la adopción
institutional ethical
responsable,
frameworks
inclusiva
that
y
can guide
equitativa de
the
la inteligencia artificial
inclusive
en la
and
fuerza de trabajo.
equitative
Aquí tenemos que
adoption
mirar
as well
que
as
ese
responsible in the
crecimiento,
workforce and the
la
healthcare
formación,
systems.
capacitación,
Now, this is about
no puede
training
quedarse
and
a la
education that
par o tiene que ir a
can't
la par con
that,
el
that
desarrollo de
can be
marcos
behind and needs
éticos.
to go
Y aquí
together
los
with the
indicadores
development
están
of
encaminados
ethical
a medir
frameworks,
el
and
número de países
indicators then have to
puestos
do with
de
measuring the
éticos
countries with
con
these
mecanismos
ethical guidelines,
participativos para la
with
evaluación y cultura
participative
del
mechanisms
desarrollo de
for the
inteligencia
ethical and
artificial.
cultural assessment
La
of
siguiente
these AI
recomendación
tools.
es
The next
desarrollar marcos
recommendation has to do
regulatorios y
with
de
developing
seguridad para el
regulatory
uso de la IA
frameworks
por parte del
and
personal de salud.
cybersecurity
Y esto hemos
frameworks and the
mirado
use
cada
of
vez más
AI
esa,
for the health workforce.
y el personal de salud
And the health
tiene cierta
workforce has
eh, duda alrededor de qué tan
may have
seguros
some
están los
questions
datos y
in
eso
how
tiene
safe
que estar
data
muy
may
de la
be.
mano
And
con
this
este
needs to
desarrollo de
go very
marcos
much by the
regulatorios
hand
y ahí
with this
están los
development
indicadores
of
del número de
regulatory
países con
frameworks, where we
regulación
have
nacional,
indicators on
institucional,
number of countries
con
with national
leyes
institutional
actualizadas y con un
regulations, with
registro público de
updated
las
laws,
aplicaciones
and
de
with a
IA
public
en salud.
registration in the applications of AI
La
in
siguiente
healthcare that are validated within the countries.
es integrar la
The
IA en la
next one is to
planificación,
integrate AI in
gestión y
planning,
auditoría de
management, and
recursos humanos de la
auditing
salud y de los
of
servicios.
human
Aquí
resources
también
and
los
healthcare of
indicadores
these
del número de
services.
países que
And
reportan
the
establecimientos
indicator
de
has
salud
to
que
do with the
utilizan
number of countries
herramientas
that
de
are
IA
reporting
en los procesos de
establishing
gestión, planificación y auditoría. Les voy a
healthcare
comentar un
facilities that
poco
are
de
using
nosotros estamos
artificial intelligence in the
generando
processes of
actualmente que tiene
management,
que ver
planning,
mucho con esta
and
gestión de la
auditing,
planificación
something that has to do a lot
y
with
prevención
management
de los
and
recursos humanos.
the
Siguiente.
human resources forecast is something that we will talk a little bit more
Por
later on.
último, fortalecer las capacidades de la
And then
fuerza de trabajo
lastly,
de
to
salud
strengthen
mediante
the
proyectos piloto de
skills
inteligencia
of the
artificial
health
aplicados a la
workforce
salud pública y
through
atención
pilot
primaria, pero
projects
que
in
tengan
AI that are
de
applied to
centro
public
al
health
personal de salud.
and
Y este es
primary
un punto
care. And they
importante. Ahí
have
está
to have as a
el
core
indicador que son
the health
los países
workforce.
que tienen un
And our
piloto
indicators are
implementado
these countries that
y
have
evaluado.
at least one
Siguiente.
pilot implemented, and countries that have one pilot
¿Y cómo todos son los
evaluate.
pasos?
So the next
Nosotros hemos
steps,
iniciado ya
we have already
y
started
tenemos en revisión un
and
panel interactivo
are
de resultados
reviewing an
llamado un
interactive
dashboard,
panel of
ya,
results
ya les
that is
vamos a
commonly
poner el
called the
código QR,
dashboard.
pero ese para
We'll share
nosotros ha
with you
sido
the
el punto
QR code
fundamental porque
in
ahora
a
ustedes
minute.
van a tener
And this
acceso
is going to be
al
paramount
detalle de
because
los
you will have
resultados
access
de
to the
este
actual
análisis
detail of
en
the
nuestra
results
página web.
and this analysis
También
in our
como
website.
próximo paso está el monitoreo del
Also, as
impacto
next
de la
steps, we have the
inteligencia
monitoring
artificial
of the
en base a los
impact of
indicadores que
artificial
ustedes
intelligence
enviaron
based on the
acompañando a cada
indicators that,
una de
as
las
you noticed,
recomendaciones.
we're coming together with each of the
Acompañamiento a los países de
recommendations.
la región en la implementación de estas
Working
recomendaciones.
together
Siguiente.
with the countries
En
in the
este
implementation
gráfico
of
ustedes pueden
these
ver
tools in the
cómo
region.
aparece este dashboard
In
en la
this
página
chart,
web
you
que
can
ustedes
see
la pueden ver
how
allí o
what
que
the
también la
dashboard looks
pueden
like in the
acceder a
website.
través de ese
You can
código
also
QR.
access to it through this QR
Este panel ya
code.
está listo, está así
So
como
this
que en
panel
revisión,
is
pero ustedes pueden
ready.
tener acceso
It's
a
currently under
información por
review, and you
país,
can have
pueden ir
access
desglosando por
for
género, por nivel
per country,
educativo,
per
por edad,
gender,
por
per academic
ocupación o por
level,
profesión,
age,
e ir
occupation,
mirando los
profession.
cambios, cómo se van
Filter them through as you need
modificando
and
las
look at how
barras en
it all
función de los
changes, how the
indicadores o de
bars
las
change
variables que
according
ustedes
to
quieran
the
mirar
indicators of the
en
variables that
este
you want
panel.
to
Así es que
find in this
una
panel.
invitación para que
So my
ya lo puedan
invitation
utilizar,
is for you
acceder
to use it, to
y con
access
gusto
it,
también cualquier
and
retroalimentación es bienvenida.
any
Siguiente.
feedback will be more than welcome.
Y los otros, sí, lo que mencionaba antes, ¿no?
And
Hablar
what
un
I was
poquito
saying
del
before, we were
próximo paso,
talking a
¿no?
little
El
bit
modelo
about the next
predictivo de
steps
oferta y
in
demanda
the
de recursos humanos de la
predictive
salud con
model of
inteligencia artificial.
supply and
Está trabajando en la
demand
unidad de
of
recursos
the
humanos
human
para la
resources
región. Tenemos
working in
actualmente un
healthcare.
entrenamiento, un
And currently,
prototipo
we are
que pensamos tenerlo
prototyping
listo a
training.
finales
We
de este
expect to
año.
have it ready by the
Y
end of
esta se
this
va a
year.
convertir en una
And this
herramienta
is
para
going to
modelo, una
become
herramienta
a
de
tool. This is
planificación y
going to be a
predicción de
model
recursos
for
humanos para
planning
la
and the
salud usando
forecasting of human resources for
inteligencia
healthcare
artificial
using
generativa. Y eso es
generative
interesante, ¿no?
AI,
En este
which is very
momento
interesting
estamos
because right
entrenando
now
a este
we
modelo
are training
usando machine
this model by
learning y, como
using machine
decíamos, la
learning and, as we've said,
inteligencia
also
artificial generativa. Y esto
the
en un contexto
generative
de,
AI.
más bien dicho, en
And
un
all of
modelo que
this is a
contextualiza la
model that
información existente ya de
contextualizes
recursos
the
humanos para la
existing
salud.
information
Estamos
on the health
alimentando
workforce.
a ese prototipo con
So
bases
we
de
are
datos
feeding
que
this
ya tenemos
prototype with
acceso. Muchos de ustedes
databases that we
conocen
already
las
have
nuestras
access
cuentas
to. Many of
nacionales de
you already
personal de
know our
salud,
national
censos nacionales,
accounts of
información
health
específica que
workforce,
ya está
national
alimentando
census,
esta
information that is
herramienta.
specific,
Y
that
como
is being
decíamos, el próximo año va a ser
constantly
de
nurturing
estudios
this
de
tool.
caso en
And then
países
next year, of
seleccionados
course,
que
as
nos
I
va a dar
said, we're going to
una
have the case
mirada mucho
studies for
más,
these countries that have been
certera de lo que
selected,
puede
and it's
hacer
going to
este
give us
modelo
a more
predictivo.
accurate
Siguiente.
perspective of what this
Con
predictive
esto
model will look like.
finalizamos esta etapa. Yo quiero agradecer a todo
And
el
so with
equipo
that,
de la
we
unidad que ha
finished our
trabajado
part, and I want to thank
bajo la
everybody
coordinación de
and the
Natalia
unit
en
working under the
generar
coordination of
este trabajo,
Natalia.
estas casi
This
3,000
work
encuestas en
that meant
33 países de
about
la región que nos
3,000
permiten tener
surveys
una
in
primera
33
mirada de
countries in the
cómo
region that
el
allowed us
recurso
to
humano
have
está
a
siendo
first
impactado
look
por la
into
inteligencia
how the human
artificial y
resource
qué
in
nosotros
healthcare is
podemos hacer al
having an
respecto.
it has
Así
been
es
an
que
impact
agradecemos
because of
muchísimo
artificial intelligence and what
y
we can do
le
about
paso
it.
la
So we
palabra a
thank
la
you very
doctora
much, and
Joana
now I
Díaz.
hand it to Dr. Joanna Diaz.
Muchísimas gracias,
Thank
Benjamín y
you very
Natalia.
much,
Muy
Benjamin
interesantes
and
todos los
Natalia.
datos que nos han presentado.
Very
Y
interesting, all
sin
this
duda
info
vemos en
that
el
you've
chat que
given
estamos
us.
despertando el
We
interés de todos los
noticed
colegas
in
que
the
están
chat that
asistiendo a esta
we are
actividad por conocer más sobre los
waking the
hallazgos.
interest of all our colleagues that
Colegas, les
want to
vamos a
know more
poner el
about these
enlace a
findings.
nuestra
So,
página web
colleagues, we're
en
going
un
to give you the
momento para
link
que puedan
to our
ir a la
website in a
página web,
minute so that you can
navegar
go to
ahí
our
y ahí
website,
va a estar disponible la
navigate through it,
información.
and you have
También
the
vamos a
information
tener una
available
copia de
there.
este webinario para
We'll
que lo
also have a
puedan
copy
revisar
of
con el
these
público
webinars so
para que
that
los
you
otros
can
colegas.
look into it and share or
Nuevamente
share
me
with other colleagues.
permito saludar en nombre
Once
de la Unidad de
again,
Recursos
and
Humanos a los más de
and
500
have the
colegas
Human
que
Resources Unit. I
a lo
want to
largo de
greet
la
the more
región de
than
los diferentes
500
países se
colleagues
están
and in
uniendo
the
con
different
nosotros en
countries
este
in
seminario.
the
Qué
region are
interesante
joining us in
contar
this
con todos
seminar.
ustedes,
It's so
colegas,
wonderful to
bienvenidos.
have you all.
Ahora
So
vamos a
welcome.
movernos
Now we're
nuevamente
going to
a
once
la próxima
again
actividad, al
move to
panel
the
de alto
next
nivel que tenemos
activity,
para esta mañana
to the high
titulado
level panel that we
Inteligencia
have called
Artificial en la
Artificial
formación y
Intelligence
práctica
in the
de la
training
fuerza de
and
trabajo en salud,
practice of the
experiencias y
healthcare workforce,
perspectivas en países de la
experiences
región.
and
Para esta
perspectives
actividad, yo
from
tengo el honor
countries in the
de
region.
invitar
And
al
for this
doctor
activity,
Marcelo de
I want to
Agostino,
invite
que
Dr.
es el jefe de
Marcelo
la unidad de
D'Agostino,
sistemas
who
de
is
información
Chief
y salud
of
digital del
Information
Departamento
Systems and Digital Healthcare
Inteligencia e
Unit
Inteligencia para la
and the
Acción
Department of
de
Intelligence and
Salud
Evidence
en
for
la OPS
Action in
OMS.
Healthcare
Quien será el
and
moderador de
PAHO
este panel y
WHO,
está
who will be
acompañado por
moderating this
cuatro
panel
panelistas muy
that
distinguidos,
is
quienes estarán compartiendo con nosotros
having
sus
the presence of
experiencias.
4 very important
Adelante, estimado
panelists
doctor
sharing with
D'Agustín.
us
Bienvenido.
your experiences. So thank
Muchísimas
you
gracias.
and
Buenos
welcome,
días
Dr.
a todas
D'Agustin.
y todos. Un
Thank you very
placer
much.
para
Well,
mí.
good morning, everybody. It is such a pleasure
Realmente
for me. This is
destacable toda la
really
unidad de
very important
recursos humanos
here
por
to
este
be here with the
proyecto,
whole
este trabajo, a
unit
tu
of human resources for
departamento, en
this
general
project, for all
asistente de
this
servicio de
work, and
salud
in
que
general
dirige el doctor
to the
Chichela.
Department of
Para mí como
Healthcare
responsable
Services
también del
by
tema de inteligencia
Dr.
artificial
Tala, and
en
also
la
for
región
me,
panamericana de salud
this topic of AI
es
and
siempre
PAHO is
un
always
valor agregado escuchar
an added
cómo
value
todos los
to be
departamentos
able
y
to
programas
hear
técnicos
how all
están
departments and
incorporando
technical
esto, ¿no? Y más
programs
aún
are
poder
incorporating
moderar
all
ese
this
privilegio.
topic
Gracias Natalia,
and
Benjamín
moderating
y
this
Johanna
panel. It
por
is
darme este
such a
espacio para
privilege.
moderar
Thank
tan
you,
respetado colega.
Johanna, for
En
allowing
primer
me
lugar,
to
quería también dejar un
moderate with this
mensaje que me mandó
very important colleagues.
iba a estar
But first of all,
originalmente en
I
motivo por
wanted
un
to send a
compromiso
message
internacional, pero quería
from
dejar
a colleague who
registrado
couldn't be
su
here with
saludo, la
us.
doctora Estela
Is
Dat, viceministra
Dr. Nestela Dat,
de
who
Salud
is the
Digital e
Vice
Información del
Ministry
Ministerio de Salud de
of
Brasil, quien le hubiera gustado mucho
Healthcare,
acompañarnos,
Digital
pero un
Healthcare and
compromiso
Information from
internacional
Brazil,
previo
but
no
she
se lo
had an
permitió, pero me pidió
international
expresamente
commitment
hoy
prior
corregir
to
su
that,
saludo.
and so she
Voy
just
a
wanted
pasar
me to
la palabra
express
primero.
her
Vamos a
greetings.
tener un
So first of
esquema
all, we're going to have
de dos panelistas con preguntas
a scheme
y dos
of
panelistas
two
con
panelists
presentaciones. Les voy
with
a pedir,
questions
porque
and
como nos
two
atrasamos
panelists with
unos minutitos
presentations.
y en
And
vez de
since we
10
had taken a
minutos
few
se
minutes,
reduce la
so
intervención a 8 minutos, si
we
no
have to
vamos a
reduce
poder
our
llegar
intervention in 8 minutes in order to
con el
make it on
webinar. Y cuando
time with
vean
this
que yo muestro
webinar.
un
So if you
corazoncito,
see me
es que
showing
ya
a
les
little
queda un
heart,
minuto.
that
Así
means
no
you have
tengo que
1 minute.
interrumpir. En
I'm
primer
going to
lugar,
have
un
to interrupt
placer
you that
muy
way.
grande
So first of all, it
presentar
is
al
a
doctor William
pleasure for
Hoyos de El
me to
Salvador,
introduce
director de
Dr.
Monitoreo
William
Estratégico
Hoyos
del
from El
Servicio de
Salvador, the
Salud del
Director of
Ministerio de Salud de El
Strategic
Salvador, donde
Monitoring in the
lidera
Ministry of
sistemas
Health in El Salvador,
nacionales de
where he's
seguimiento y
leading national
evaluación.
systems
William es
of
especialista en gestión de
tracking
información para
evaluation.
la toma de
He's
decisiones en salud
specialist in
pública.
decision
Ha
making
impulsado
for
modelos muy
public
innovadores
health
para
care, and he
fortalecer la
has promoted
eficiencia,
very
el
innovative models
desempeño y
to
la
strengthen
planificación
efficiency,
estratégica del
performance, and
sistema
strategic
sanitario
planning
salvadoreño,
of
y hoy
the
se está
Salvadorian
destacando por un
healthcare system,
componente
which
muy
is
grande de
outstanding
transformación
today by
digital
a
del
very
sector
important
salud.
component of
Así
digital
que sin
transformation
más,
in the
en
healthcare
honor
sector. So
además un gran amigo
with
de la
it's
casa
an honor.
y
He's also a
personal, le
great
paso la
friend
palabra al doctor William
of
Hoyos para
mine.
que
So I hand it now
nos
to Dr.
pueda
William Hojo so
compartir
he
un
can
poco,
share
considerando
with
que El
us,
Salvador, y esta semana hemos visto muy
keeping in
presente en
mind
los medios
that
de
El
comunicación,
Salvador, and this week
avanza de
we've
forma
seen
muy
this very
sólida y
much in the
sostenible en la
social media that is
transformación digital. Ese
advancing
fue un
very
mandato presidencial de
robustly
múltiples
in digital
iniciativas
transformation from the very
y aliados
presidency
en el
with many
campo de la
initiatives
salud digital y en
and
particular en
partners
la
in digital
inteligencia
transformation,
artificial.
particularly
Lo
in
que es
artificial
una
intelligence.
pregunta combinada,
So here's
William.
a question, a
Primero,
combined
que se
question,
habló recién de
William.
la necesidad de
First,
instrumentos
what was said
normativos.
earlier
¿Nos
about the
podrían
need
explicar cómo
of
la ley de
regulatory instruments.
inteligencia
If you can tell
artificial
us
de
how the
Salvador se
Artificial
articula con
Intelligence
estos
Act
procesos de
in El Salvador
modernización de los
is
sistemas de
articulating with
salud?
these processes
Y
and
como
the
segunda parte,
updating
y bien
of
asociado al objetivo de
healthcare
este
systems, and
importante
very much
webinar
linked
que nos
into the
convocan hoy los
objective of
colegas de la
this
Unidad
very
de
important
Recursos
webinar
Humanos,
that is,
es si
gathers
podría
us all.
profundizar en el
If you could
impacto actual
delve further
esperado
in the current
de la
impact
inteligencia
expected
artificial en el
of artificial
fortalecimiento
intelligence to
de los recursos
strengthen
humanos del
the
sector salud,
human resources
así
of the
también como
healthcare
cuáles
sector,
son las
as well
principales
as what may be
oportunidades que
the
están
most
visualizando
important
para ampliar
opportunities
estas
you
capacidades y
visualize to
seguir
expand
preparando
these
al personal en
capabilities and
este
keep
nuevo
on training
entorno digital.
the
Así es que, bueno,
workforce in these
adelante, William, y
digital
muchísimas gracias
settings.
por
So
el
go
tiempo
ahead,
con
William, and thank you
nosotros.
very much for being with us.
No, gracias a ustedes y honrado de
Thank
estar
you
aquí
all. It is an
hablando de un
honor
tema que
to
nos
be here
apasiona, que es la inteligencia
addressing the
artificial
topic that
y la
is of our
digitalización de
passion,
los servicios
which
de
is
salud.
artificial
Antes que nada, pues
intelligence
bueno, la
and
regla esto comienza
digitalization of
desde
healthcare
liderazgo.
systems.
Los
First of all,
tomadores de
this
decisiones
becomes something that starts
hacen que
from the
esta
very
ley, la
leadership,
ley que
decision
fomentó
makers, that
a la
makes
IA y a
that
las
this
tecnologías
law,
no sea de aparición
the
espontánea,
the
sino que
law
se enmarque dentro
for
de un
the
proceso estratégico. En el
the encouragement in the
2023,
use of these
el
technologies within the
Ministerio de Salud
2023's
firma el
framework, where the
GPS,
Ministry of Health had
la
signed
estrategia de
together with
cooperación de
PAHO
país. Y
the
allí en
country
la quinta
cooperation
prioridad
strategy, and
estableció el
in the
desarrollo de
fifth
las
priority, we
capacidades
established
nacionales
the
para
development of
la
national
innovación,
capabilities for
investigación, la
innovation,
evidencia científica
research,
y la
scientific
incorporación
evidence,
de
and the
tecnología
incorporation of
y
technology
transformación digital en
and
salud.
digital transformation
Posteriormente
in
se crean
healthcare.
otras leyes y se fortalecen
Further,
leyes como la
after other
protección de
laws are
datos,
created
deberes y
and
derechos de los
brought up,
pacientes,
like data
y esto encaja
protection, rights
perfectamente
and
con
duties of
la creación
patients,
de
and
una
all of this
ley
fits
que
together
se llama Ley
perfectly
de
with
Fomento a la
creating
Inteligencia
these
Artificial y las
artificial intelligence and technologies use act, all this to come together in consistency with what the study brings up, the very important pillars that I think are paramount and of special importance, particularly to generate trust, not only in the population, but also the internal users, that is the healthcare workforce. So first of all, The very law considers the need or the mandate to integrate artificial intelligence into public services to be able to also optimize their performance. And so within them, we have appointed specifically the area of healthcare. So that's where there's a certain degree of confidence because using AI in these services as a help gives you the perspective to improve the quality of life in an equitative manner, not only for the users, but also, as our colleague has said before, for the healthcare provider who is exhausted, who's tired and overwhelmed. So artificial intelligence can be very useful to reduce this burden. Another important part here is the scaffolding of protection, establishing a regulatory ethical framework with an important emphasis on healthcare data management and ethical principles that highlight, as you've said, equity. And something very important in the law is transparency, the shared common responsibility of the informed consent, the minimization of data, inclusiveness, and non-discrimination. And all this also brings along the creating of the National Artificial Intelligence Agency, which is at the same time the authority, the steering agent who encourage uh, research and its application with technical assistance. So, how is this coming together with education? Well, it comes as a mandate to be able to coordinate it with the Ministry of Education, Science, and Technology to then start training the citizens in El Salvador at all levels of training. That is from their very studying level up till their specialization. This alignment goes together, as we've said since 2023, with the need to align the strategy into the process of digital transformation. This law is working together with other laws existing as cybersecurity, information security, and personal data protection that have as steering principles to be able to guarantee all the citizens the protection of their information and capability of access, correction, cancellation, opposition to some of them, portability as well, the right to be excluded, and digitalization. All of it always supervised by the same human agency, in this case, healthcare ministry, together with the agency. So it's a structuring and articulation of several strategies that were established from the beginning in the administration plan to the strengthening that we see now of healthcare digitalization. Strategies fit one by one. So what we are after is that they can work together in the training in field with a very important change management with our digital native implementers that started with a project to digitalize the clinical records are now working in the implementation in the healthcare facilities, and they are also enablers and trainers with some pilots of artificial intelligence that we could refer to later on. So, change management is very important together with the working together to generate confidence and to reduce this kind of fear that we have against artificial intelligence. We have seen some of the concepts or preconcepts that population has against the risk. And so establishing a law based on risk protection is very important to be able to address something as important as it is the citizens' information.
Muchísimas gracias, William. Excelente.
Thank you very
Dentro del
much,
tiempo
William.
agradecemos
It's
mucho.
excellent.
Se
And we thank you
destaca muy
so very much
agradecemos
for the use
también
of
hace
time.
no más de 2
Um,
semanas El Salvador
Not
fue
more
sede
than
de
two
un
weeks
evento
ago,
muy
El
grande que
Salvador
tuvimos
was
con
the
todos los
venue of a
países
very
de la
important
región de las
event we
Américas
share
junto al
with all
BID
of the countries in the
para acelerar
Americas
los
together
procesos de
to
transformación
excel, to
digital
speed up the
en el sector
processes of
salud.
digital
Muchísimas
transformation in the
gracias, William.
healthcare sector. Thank you very much,
Ahora tengo
William.
el placer
Now, it
de
is a
presentar y
pleasure
de
for me
introducir a
to
la doctora Deborah
introduce
Cohen
Dr.
de
Deborah
Canadá.
Cohen
Ella es
from
Chief
Canada.
Operating
She
Officer de
is
Health
the
Workforce
Chief
Canadá,
Operating
con amplia
Officer from
experiencia en
Health
planificación y
Workforce Canada with a
fortalecimiento
wide
del talento
experience in the
humano en salud.
strengthening of human resources in
Lidera
healthcare.
estrategias
She's
nacionales
leading
para
national
mejorar la
strategies to
disponibilidad,
improve
movilidad
the
y
availability,
sostenibilidad del personal
mobility, and
sanitario de
sustainability
Canadá.
of
Es
the
reconocida por su
healthcare
enfoque
workforce in Canada.
colaborativo
She's
y
known
por
for
promover
for her
políticas de
collaborative
fuerza
approach
laboral
and to promote
basadas en evidencia.
policies for
Un placer
workforce
muy
based on
grande,
evidence.
Débora,
So it's such a
tenerte
big
aquí junto
pleasure,
a
Deborah, to have
nosotros.
you here with
Canadá es
us.
un país, un
Canada
estado miembro
is
muy
a member
importante
state that is
para la
very
Organización
important
Panamericana de la Salud
for
y valoramos
PAHO,
muchísimo
and
tu
we
tiempo.
very
Así
much
que adelante
appreciate
con
your
tu tiempo.
time. So
Gracias.
go ahead with your time, Deborah.
Thank you very much for the invitation. I think someone is going to pull up the slides for me.
Ok, a ver si alguien tiene la presentación de la doctora Débora. Ok,
There it
perfecto.
is. Wonderful. So let's go to the first slide. I thought I would start off by telling you all a little bit about Canada. Um, just to set a bit of context for health workforce and the way that it's interacting and intersecting with digital and AI at this time. So if you see the pretty picture of the country that is made up all those different colors, Canada is actually the second largest country in the world. So it is a massive, massive landmass, but its population isn't huge. So we're 40, 45 million people spread all across this huge country. If you look at the bottom parts of the colorful parts of this graph, these are all the provinces and territories where the majority, about 85% of our people live in cities. And if you look up at the blue and gray areas, that's the Great White North, where literally you do not have access to some of these communities unless there is an ice road in the winter. Otherwise, you're flying in. And that's a very small number of people that live in the Great White North. But we still have to deliver healthcare all around the country. So this creates this very interesting challenge for Canada. The second interesting reality for the country is that because of our constitution, each of the provinces and territories, and there are 13, have the authority and the autonomy and the responsibility for delivering healthcare, and by extension, planning for health human resources. So if you think about Canada's healthcare system, it's not one, it's really 14. It's the 13 provinces and territories, plus the federal government, who has responsibility for delivering healthcare specifically for Indigenous peoples in this country. So it's kind of like 14 independent countries that are trying to collaborate and plan all at the same time. So what does that mean for health human resources? Well, it means that planning can be a real challenge. And COVID showed us that planning in an emergency state where you need to be able to move your health workers around the country to deal with outbreaks is a real challenge with this type of setup. And as a result, we have created an organization called Health Workforce Canada, which is the one that I represent, to try to come up with strategies to work with the Constitution and the fact that we have healthcare delivery across this country in 14 different ways, but to cohere a solution that is collaborative and that allows everyone to work together. And this is where digital and AI becomes a big part of the story. The vacancies just on the right-hand side here, you can see vacancies for health work positions are much, much higher than they were 10 years ago. We're sitting around 90,000 vacancies per year. And if you think about what that really means in terms of overtime, the people who are in the system delivering care, we had in 2024 32 million hours of overtime. So those are already stressed out workers who are doing more work and to the tune of about 16,000 full-time equivalents. So we've got the challenge that everybody has with health workforce. So let's go to the next slide and I'll tell you about Canada and the digital era. In some ways, Canada has been a leader in AI. In 2017, Canada introduced the first national AI strategy in the world. And this continues to be the thing that orients Canada. It really focused on a significant investment in academics and in research supporting AI. But to be honest with you, in 2017, AI really wasn't as, significant and available as it is today. And healthcare really wasn't the first or the first group to jump in and put up their hand and say, we want to adopt this. That remains true today. And so in 2023, we saw the federal government say, how can we get healthcare to come with us in this AI revolution for all the reasons we've talked about already? And so there was significant funding to the tune of $200 billion to push AI forward in a number of parts of healthcare, including health workforce planning, mental health, and primary care. But still, we have, because of the federated nature of our country, slow adoption. And so in 2025, to really help the governments figure out, are they operating in a strong and ethical way, which is their orientation, we developed the guiding principles to steer ethical and responsible use. And you can see, I won't go over them, but you can see all the principles that are included in that guideline. And that is the principle that organizes and helps implementation for AI. The truth is, we're still on this journey, and in some cases, we're seeing great adoption. In other cases, we're seeing that worry, the trust, the fear, not slowing us down. So it depends on where you're looking in the country. Next slide, please. I want to tell you a little bit about our organization. We were born 2 years ago out of this, some of the funding to the federal organizations in the country. We were born, and the goal here was to help create this sort of cohesive planning strategy and advancement of things like digital and AI. And some of the things that we've done have been to centralize data and tools, because the fact is, if you want to move forward with AI, you have to have a lot of data. And in Canada, like in every country, the data is there. It's just spread out all over the place, so you can't find it. And so if you can centralize it as a starting point, that becomes critical. This data dashboard is now live. It produces all the information that we have about health workforce in Canada in the form of visual dashboards. So you don't have to have an epidemiology degree to sift through reams and reams of data. We centralize it for you, and it includes information about employment and primary care and vacancy rates and even worker wellness. So it's a great resource, and policymakers say even that as a starting point is a really big improvement for Canada. If you go to the next slide, we are starting into improving our modeling and forecasting. If you can imagine, because of the way we organize healthcare, we have 14 different predictive models for how many physicians we need, how many nurses we need, how many, allied professions we need, and they don't all agree with each other. And so what's the answer? So how do you create these sort of pan-Canadian models that help people work together? Our work right now is in using machine learning and microsimulation techniques in advancing a couple of areas that are really challenging. For example, how do you plan and predict, not for physicians and nurses where the data are good, but for those professions where the data are not good, like personal support workers or those healthcare aides? We don't have good data about those folks. So you have to use machine learning to create some agent-based models to make assumptions and then produce forecasts. And you can see the bottom part of the graph here is what we do there. We also are very interested in understanding the projections between when you're educated to when you become employed. Typically, we don't have good predictive models that talk about that landing. And so it's hard to know how many people to educate. So these are the kinds of models that we pursue. The next slide, please. One of the things that is kind of cool about what we're developing is a recognition that a policymaker in any country, but particularly in Canada, really struggles to know what's going on across the country. There's pilot projects all over the place. And so if you wanted to implement a policy, you might not know that same policy was implemented on the other side of the country and that it didn't work, or that it did work. And so how do you go about sharing that knowledge? What we've done is create an AI-driven digital front door where we've created this sort of AI repository or AI brain, and you can ask this thing a question in English or French, our two national languages, and you don't have to be a data analyst. You just ask it the question, and it will give you back an unhallucinated, correct answer on what's going on with a reference to where that information actually exists. This has become a big deal because it doesn't just think about health, health workforce and AI from a direct care perspective, but from a planning perspective. And there are huge opportunities if we can use AI in this space. So the next slide, please. I also wanted to talk about stuff that's happening in the country because the country is very, very big, as I mentioned, and there are really, really innovative pockets that I think we should pay attention to. The first one I want to draw attention to are these ideas of digital twins, and I'm sure some of you guys are seeing this in your countries too. But a digital twin is essentially the region, for example, or a hospital taking all the data that they have, every last piece of updated data on every patient and then starting to create policy scenarios with a digital twin that has the exact same data in it so that you're not implementing the policy and saying, oops, that didn't work, but you're using AI to try to run a series of scenarios to find the most optimal scenario, particularly for health workforce planning in this case, before you go and implement it on human beings. And so this is actually creating AI for planning that is allowing us to make fewer mistakes and create efficiencies in policies. That has been a big change maker for the country. So these things are happening and starting to happen across Canada, and there's something to watch. The next slide, please. The other thing I wanted to talk about were AI scribes. Everyone's hearing about AI scribes. They're reducing the burden for general practitioners and physicians. But physicians have been slow to adopt, haven't they? Because they are, to some extent, not interested in bearing the cost of bringing AI into their already expensive practices, and they don't know which AI system to use. There's a bajillion of them. So this initiative was launched by Canada Health Infoway, and just this past summer, Infoway gave away 10,000 AI scribes licenses to general practitioners' offices across the country. This has been a major system changer for family practitioners, and already we're seeing some data. 93% already feel more present with patients during visits. 89% are reducing administrative burden and 85% are lowering cognitive burden. So when we think about those entry points into how to get people to participate with AI, a big part of what we have to think about are the cost barriers, not just the learning barriers, but the cost barriers. The last example, if you go to the next slide, I want to talk about, and this is where you guys have already been talking about the education. Yes, education for health workforce is important, but we also have to educate our leaders. Why? Because our leaders are the ones who are the most concerned about responsible use and governance and privacy and ethics. Those guys will be the people who allow AI to come into their hospitals or their regions, or will be the reason that they do not come. And so, if we think about the type of things that we're seeing in the country, we see university programs, this one happens to be in Ontario in the middle where I'm from, that are not focused on educating the students, but those 55 and 60-year-olds who are not used to AI, who already have a natural worry and fear for that type of product, and to explain to them and show them the art of the possible, as well as to help them ask good questions, because that's what a good CEO does. They don't have to know the things, they have to know the questions to ask. These are the kinds of programs that can become very transformational for the country and for around the world in order to help move the yardstick forward. So those are my comments. Thank you for the opportunity to present today.
Thank you. Thank you very much, Deborah. This is the time that we would love to have 2 more hours hearing you, but thank you. Thank you so much. Entonces, vamos a pasar
So
ahora
we
a
are
la
going now
siguiente
to
panelista,
the
la
next
doctora
speaker. We have
Sulmanova,
Doctora
directora del
Sulmanova,
Instituto de Salud
Director
Pública de
of
la
the Public Health
Pontificia
Institute of
Universidad
the
Javeriana de
Pontifex
Bogotá,
Javeriana
Colombia,
University of Bogota, Colombia.
experta en epidemiología,
Expert in
matemática y estadística
epidemiologics, maths,
aplicada.
and
Su
digital
trabajo
or
combina
health, digital health.
abarcar
Her
biopresencia
work
operativa de una
combines,
maravilla
and I'm
poder
going to
tener
call your
esta
attention of
experiencia
this because
científica
there's a
pero
wonderful
combina
experience. She
modelamiento,
combines modeling,
ciencia de datos y
data
políticas
science,
públicas
and
para
public
abordar estos
policies
retos de
to
manera
address these
infecciosa y de
challenges of
decisión
infectious
esencialista.
diseases and
Ella es
decision-making
investigadora
and health.
destacada
She
por
is a
su producción
researcher,
científica y
outstands for
publica
her
en
scientific
clásicos
production. I invite
académicos
you
de
all
Javeriana.
to read
Muchísimas
this. I
gracias por los días de
learn a
divulgación
lot
científica
about that
y
in
su
recent
contribución
days,
al
and her
fortalecimiento de
contribution to
capacidades
the
en salud
strengthening of
pública, no solo en
capability
Colombia,
building in
sino
public
también
health, not only in
dentro de
Colombia,
América. Entonces
but
le
across the
doy la
region.
palabra
So
a
I
Sulma. Sulma,
leave you
adelante.
with
Te hago
Sulma. Sulma, the
declaración de
floor
uso
is
para los próximos
yours.
2 minutos.
I'm going to post
Muchas
a heart when
gracias,
we are five
doctor.
minutes
Muchas
away.
gracias a
Thank you, Doctor. Thanks to all of you who are here with us. And it's truly is an honor to be here with you. I'm going to present some thoughts and reflections, very short ones, about the capabilities and digital skills for health staff in this era of AI. I will be sharing my screen. Let me know if you can see my screen. Yeah, we can see that perfectly. So, to start with the idea of digital skills and different competencies, there are so many health staff that we should develop throughout the different health systems that I will present just a case study of how sometimes we can find options with AI applicable to health system, opportunities and interesting and important challenges as well. So this study case, a few months ago during a clinical visit to a country in this region, I was able to see, witness an AI pilot project that was implemented to optimize the assignation of staff and personnel in health centers in rural areas. Now, the system really was well developed in the sense that it had data from climate, patterns of mobility, KPIs of diseases, and of course they uploaded that information very well. Part of our predictive model recommended to find out in what areas, in what zones of the country in particular, more nurses and doctors were required, and how that was changing in the course of some weeks. But something started to show that the prediction of the model was not good. And that is that several communities, the faraway communities, they were being left without assignation of staff, even though the epidemiological KPIs show an increase, for instance, an increase in respiratory diseases in those regions. Field epidemiologists provided the alert. He knew the system from inside and knew that the community has frequent uh, power cuts, and that, of course, lasted for days, and that also took days to reach the central where this data was used to feed the model. So for this algorithm, those gaps of information were shown as low activity, low need of the staff in that area. But for health staff that were living in the field was totally the opposite. It was alert. And that took us to think that the flaw in use of this model is not the algorithm, but the context, and different contexts even. And certain information could mean different things. In this context, the absence of data was interpreted by the model as of low demand, and that turn means that the use of this model requires of local knowledge of the persons that live there and on part of the staff that works there, as well as constant human supervision. So the message in this case for this case study is deep in respect to the use of AI in practice, in the deployment, and the local context. The AI fails when the local knowledge is not incorporated, or where there are no competences or skills on part of the health staff to supervise and correct potential mistakes that AI may commit. And that is why that even though AI requires of data, it requires also of context. And that context exists only if the workforce, our health workers, have the right skills to identify those flaws, the bias and risk before they go into the cycle of the model and, of course, the making of the public policy that comes out of it. And this is just an example to show that there is a problem of human capabilities, and that's something that we need to solve. How do we understand data? How we interpret data in our own territory? How do we supervise different models? How to transfer our
a ese ciclo
operational
de vida de la
context to
inteligencia
the life
artificial.
cycle of AI.
Si queremos que esa inteligencia artificial
If we
mejore
want
los sistemas de
AI to
salud
improve the
y,
health
y que no
systems across the
amplifique las
regions
inequidades
and
que ya
rather does not
existentes,
amplify the existing
necesitamos definir con
inequalities, well,
claridad
we
qué
need to define
competencias deben
clearly
ser las fuerzas
what
laborales.
competencies and
Por
skills
supuesto,
must be
como lo
incorporated to the
decía la
workforce. And of
doctora
course,
Cohen,
as
no todo el
Dr.
mundo
Cohen remarked,
sabe
not
programar
everybody
estos
knows
sistemas de inteligencia artificial,
needs to
pero
know how
todos sí
to
debemos
program
tener un nivel de
AI, but we
competencias
all should
de
have the
acuerdo
right
a nuestro
skill
rol
level
dentro del
according to
sistema de
our
salud.
role in the health system.
¿Qué problemas
Now,
estructurales
what
entonces
structural
requieren que
problems
estas competencias
require that these skills and
que sean
competencies
superadas por
be overcome,
mediante el
let's say,
desarrollo de
through
competencias?
the
Uno,
development
pues
of
refiere a
skills?
la
And one,
infraestructura
we know
heterogénea de
heterogeneous
los datos. Aún
infrastructure of
persisten
data that
sistemas
persists
fragmentados
still
en
because there
cuanto a
are
la operabilidad
fragmented
nativa
systems
y
that
allí
do
hay
not
graves
operate
desafíos.
or do not
Segundo,
interoperate,
en
rather.
muchas ocasiones hay
And
falta de
on many
estándares
occasions, there's a lack of
o
standards
ausencia de
or
metadatos
absence
y
of
entonces hay una necesidad
metadata,
grande de
and there's a
competencias en
big need
gestión
of
responsable de datos.
responsible management of data.
Tercero, en
And
muchos
number
países de
three,
nuestra
many
región, como en
countries
el caso
across
como
our region, such as this
se
case
están
I'm showing to
implementando
you,
pilotos sin
pilot
evaluar
projects are being
necesariamente
implemented
todos los
without
riesgos, cuál
assessing
es interna, externa,
the
o de cómo
internal and
podemos
external
generalizar o
assessment of how we
transportar,
can
digamos, un modelo de un
transport
lugar a otro.
one model from another
Y
one
pues
and
hay un
adapt it
riesgo
to that
grande de
new context.
dependencia
And there's a big
tecnológica,
risk
es
of
decir, aquellos
technological
modelos
dependence.
que no
That is to
sean
say that
abiertos, no
those
sean
models that
transparentes, no
are
sean
not open,
auditables,
transparent, that are not
sobre
being
los cuales
audited,
no
or
tengamos
maybe
soberanía
over which
sobre
we don't have
los
sovereignty,
parámetros, el
uh,
entrenamiento con los
the
datos.
parameters
Entonces, a
of
raíz
data,
de esto,
uh,
nosotros hemos venido
surveillance
creando
of data. So we have been creating
una idea general de un
an
sistema de cómo
idea
podría
of a
funcionar
system,
con
how
diferentes
the
niveles de aprendizaje
different
de
levels
estas
of learners
competencias
could be
que se
implemented,
requerirían en la
especially
fuerza de
the
trabajo
skills that are
interna para
required by
operar
the
estos
workforce
sistemas
to
aumentados por
overcome the
inteligencia
challenges
artificial.
that, of
Y esta
course, are
serie de competencias se
amplified
podrían
by AI.
dividir
And these
en
skills can be
competencias de
divided
base que
in
deben ser transversales
baseline
a todo el
skills
personal de
that should
salud,
be at the same time
unas
cross-cutting
competencias
to all the
intermedias
workforce,
que se
intermediate
irían
skills
más a roles
that
de
are
decisión
more
sobre, por
oriented to
ejemplo,
decision-making roles
aspectos
uh,
clínicos o de
on
vigilancia y
clinical
gestión y unas
aspects or
competencias
surveillance and
avanzadas
management, and
para
advanced
equipos más
skills
estratégicos
for
y
more
técnicos en los
strategic teams
países.
or groups in
Voy a
different
rápidamente
countries.
describir de qué se
So I'm going
tratarían
to
estas
describe
competencias de
quickly
base
how these
que son
baseline
transversales a todo el
skills
personal
that
de
are
salud
cross-cutting, as I said
implican
before, are,
unas
and
competencias en
that
alfabetización de
implies,
datos,
of
cuáles son
course,
los tipos de
literacy on
datos,
data. What are
cómo
the different types
generar
of data? For instance,
datos de
how to
calidad,
generate
trazabilidad,
high-quality
entendimiento
data,
de arquitecturas
traceability,
básicas de
understanding
información,
of the basic
capacidades para
information
evaluar
architecture,
la
capacities to
salida de
assess
los modelos,
the output
identificar
of different
sesgos
models,
algorítmicos
identify
respecto de
algorithm bias,
representatividad, señales de cambio o
representation,
de
and
inequidades. Y
changes or
esto permite
inequalities.
que las
And
personas
this
puedan trabajar con
allows for
inteligencia
persons
artificial,
to
pero no
work with
dependan
AI, but
completamente
do
de
not
ella.
depend
Es decir, que
blindly
se use con
from,
seguridad
let's say,
clínica y
that they can be
epidemiológica,
used
que
with
se reduzcan inequidades y
clinical
que no se
epidemic
amplifiquen
certainty,
errores
and
que pueden
especially
venir
that
del diseño de
mistakes
los
do not
modelos
amplify it
para que
without
estos modelos no
incorporating in
tengan
the design of
desempeño,
models so
eficacia o
that these models
eficiencia.
can perform
En los niveles
properly, keeping the
medio,
quality. So
entonces, hay
at
otra serie
intermediate level, there are
de
another
competencias que serían
series of skills
ideales, como
that would be
poder
ideal.
interpretar más
So
en
that is
detalle lo que hace
how
la
to
inteligencia
interpret in
artificial, su
detail what
secuencia de
AI does,
proceso, cómo
to
se
understand the
construye,
general
se usa el
process on
modelo,
how
revisar,
the model has been
tener
built and how
capacidades
it's
para
been
revisar textos
used, have the
técnicos para
capacity to
comprender qué
go over
significa un
technical
modelo
data sheets to
confiable,
understand what is a
asegurar que no
reliable
genera
model
riesgos
and make
clínicos.
sure that
Y
the
tampoco se
use, the
trata de
model
saber
does not
programar,
generate
pero
clinical
sino
risks.
de
It's
aprender
not a
herramientas de
question of
supervisar
software
estos
programming,
modelos.
but rather to
El
supervise the
personal
model.
debe conocer a nivel
Staff
conceptual
should
estos procesos
know
de
at conceptual
preprocesamiento,
level these
el
phases:
entrenamiento, la validación, el
reprocessing,
despliegue,
training,
monitoreo
validation, deployment, and
y uso de estos
monitoring of
modelos.
the use of the
Y
model.
ya,
And
por supuesto,
of
pensando en
course,
que existen estándares
thinking that there
internacionales
are
a través de los
international
cuales debemos
standards
apoyarnos, como los
which
estándares
we
para el
can
desarrollo de
support
software
ourselves
médico,
for the
de
development
software
of
de
medical
salud,
software, health software,
reconocer cuando un modelo puede
recognize
generar mayor
when a model
riesgo que
can
condiciones de
generate greater
complejidad
risk
para
and what
usarlo,
conditions
cuando
should be
debe
met
detenerse
to
su
use
uso
it,
y que
when the use
toda
should
la
be stopped.
lógica que
What
manejemos
is
para
the
cualquier
logic
tecnología
behind the
pudiera
model for any
hacerse
medical
realidad en el
technology
sentido
in
de
respect to
pueda ser
the
aplicada para estos algoritmos.
safety
Y a
of
nivel
the patient.
avanzado,
And
entonces,
an
la
advanced
Secretaría
level,
de
It is a question of competencies or
relación con
skills
los
for those
sistemas,
responsible for
la parte
system
como de
architecture,
integradabilidad, análisis de
interoperability,
despliegue de
analysis,
desarrollos modernos,
deployment of
sistemas nacionales de
equipment,
inteligencia
and
artificial
national
que
management
permiten
managers
que
for
no sean
AI,
solo usuarios de
meaning
la IA,
that they are
sino
not only users of AI,
desarrolladores
but
estándares
also
para la
establish the
gobernanza, la
standards for the right
internacional.
governance, audit, and adaptation of
En
these
estos tres
models
niveles,
and
digamos que
AI.
podría
So
un
for
poco
those three
resumir las
levels, we can
capacidades
say that
necesarias
yeah,
para
we can summarize the necessary skills
generar
that are required to
la
generate
inteligencia en nuestros sistemas de
the
salud.
inclusion of AI in
Como
our health.
mensajes finales, la
As
adopción de la
final
IA
message, the
esto no
adoption of
depende
AI
solo
does not depend
de
only
pues, la implementación de los
on
algoritmos, sino en nuestra
implementation
capacidad para
algorithms, but
operar
rather in our
conforme a
capacity to
estándares
operate pursuant to
internacionales, de evaluar
international
los riesgos,
standards,
bajo marcos
assess
técnicos,
risks under
adaptar los
technical
modelos en
frameworks,
tiempo
audit
real
models in
y
real time,
garantizar muy
and
importante la
guarantee the
soberanía
technological
tecnológica.
sovereignty. Um,
Los sistemas de salud que
the
no
health
desarrollen estas
systems that do
competencias
not
no
develop these
podrán
skills
integrar la
cannot
IA de forma
integrate
segura,
AI in
ética
a
y
safe
efectiva,
way,
y eso es
ethical, and
muy
effective way
importante
as
para
well.
nuestra
And that, of
realidad.
course, is pretty
Y
important for our
me
reading.
despido con
And I
este
say
mensaje
goodbye with this
del
message
doctor
from
Tedros,
Dr.
director de la
Tedros
OMS, quien
Adhanom, the
dice,
director
la
of
inteligencia
WHO. He
artificial
says
ya está
the AI has
jugando en
already
el
played
diagnóstico
a
y
role in
cuidado
diagnosing
clínico,
clinical
en el
care,
desarrollo de
drug
medicamentos, la
development,
vigilancia
disease
enfermedades, en
surveillance, outbreak
post-outbreak y el
response,
manejo
and
de los
health
sistemas de
systems
salud. El
management.
futuro del cuidado de la
The
salud
future
es
of
digital
healthcare is
y
digital, and we must
nosotros
do
debemos hacer todo
whatever
para
we can to
promover el
promote
acceso y
universal
movilidad a
access
estas
to these
innovaciones y
innovations and
prevenir que
prevent
se
them from
conviertan
becoming
en
another
otra
driver
fuente de
for
inequidades. Muchísimas
inequality.
gracias por su
So
atención.
many thanks to all of you.
No, muchísimas gracias a vos, Zulma.
Thanks
Excelente la
to
gala,
you,
como
Suma.
veo que
Excellent
llevaste unas
presentation,
horas
as I told Deborah.
escuchándote.
You, we can
Paso
sit there
inmediatamente y
here
aprovecho
if we
también
listen
para
to you for
invitar a todo el
hours.
mundo
And
a
I
leer
want to
los
take this opportunity
editoriales
to
que acaba de
invite you
traer también el
to
doctor Luis Barbosa,
read
nuestro
the
director de la PAHO, en
editorials
esta
of
posición
our director
justamente
of
priorizando los temas de
PAHO here in
inteligencia
the region,
artificial y
prioritizing the
cooperativo
topics of
social.
AI and
Le
digital
voy a
transformation
pasar
of
ahora
the
la
health sector.
palabra
Now,
al
I'm
doctor
going now
Daniel
to
Luna,
Dr. Daniel
director de
Luna,
Informática en Salud del Hospital
Director of
Italiano de Buenos Aires,
Informatics of
una
Health at the
institución
Buenos Aires
referente no
Hospital.
solo en
It's
la
a reference
región, sino en el
institution, not only
mundo, es
for
el
the region,
primer
but for the world.
centro
It's
colaborador
the
de la
main
OPS y de
collaborating
OMS
center of
para sistemas
PAHO
de
and
información y
WHO
transformación
for
digital.
information systems and
Daniel ha
digital
liderado
transformation.
desarrollos
It
como
has
equitable,
led the
técnicas de
development of
electrónica,
clinical schemes,
interoperabilidad, modelos de gobernanza y
interoperability, governance
pionero, un
models, pioneer,
referente
and
para muchas
reference
personas,
for
en las cuales
many
me
persons,
incluyo, en todos los
included
temas de
myself in that,
innovación,
for
transformación
everything that's got
digital
to do with
y hoy en
innovation,
el tema
digital
de inteligencia
transformation,
artificial.
and of course
En este
AI as well.
sentido,
So,
Daniel,
in that sense,
sabemos
Daniel,
que el Hospital
we
Italiano
know that Italian
es
hospital in
reconocido por
Buenos
su
Aires is
visión
widely
y por
recognized
eso
for
ha
its
sido
vision,
certificado como un
and
segundo
that's why it has
colaborador.
been certified as a
Sabemos que están
collaborating
dando
center.
pasos
We
muy
know
firmes en la
that it's
adopción ya
taken
de hace
big steps in
algunos
the
años
adoption
en
for
el
some
tema de
years now
inteligencia
and adopting
artificial.
AI.
La pregunta
So
tiene dos
the
componentes. Lo
question
primero
has
es
two components.
si
First of
podría
all,
destacar cuáles son estos
perhaps if we
principales
can
proyectos
highlight
que han
what
traído
are the
curiosidad a
main
varios países.
projects. There are
Ministros nos
many
preguntan
countries
sobre
are
los
curious about
proyectos
this.
que
Ministers
impulsa
have
todo el
been asking
hospital,
about these
cómo
programs being
encajan
implemented
dentro
by
de la
the hospital and
estrategia
how do they
institucional.
fit
Pero
in
ya
the institutional
conectándolo
strategy. But
al tema
connecting
que hoy
that
convoca
to the
este
topic we have
seminario,
been discussing
es
in
cómo
this
ha sido la
webinar
reacción y el
is
impacto
what
de los
has been
recursos
the
humanos
reaction and
frente a esta
impact on
adopción de
human
la inteligencia
resources
artificial
before the
y
adoption
cómo
of
están
AI,
visualizando
and how are
ustedes la
you
gestión de
visualizing
cambios que
the
mencionaban también
change,
los colegas
management of
anteriores,
change that some
en
of
un
my colleagues
proceso que
mentioned
va a
before,
seguir
in a
creciendo y sin
process
duda
that, of
que va a
course, will
escalar
continue
y que
growing,
va a ir
that will be
sumando
scaling up
nuevas
and
rampas
adding,
de innovación en
adding
las
new
instituciones de salud
layers
del
of
futuro.
innovation in health,
Adelante, Daniel, y
in all
muchas
health
gracias.
institutions. So, Daniel, the
Gracias
floor is
Marcelo,
yours.
gracias
Thanks,
Benjamín
Marcelo,
y
and
Natalia
thanks
por la
to
invitación.
Natalia for the invite.
Primer disclaimer
Well,
para hacer en
first
relación al
disclaimer
resto de los
to do,
panelistas es
uh,
que
with
el
respect to other
resto tiene una
panels of
visión
speakers,
más de salud
that
pública y
there is
epidemiológica,
a
lo cual me
view of public
parece
health
extremadamente importante
that
y es
is
algo
extremely
que es
important,
el
and that is something
foco principal.
that is
Entonces,
the main focus
así que
of
el primer
PAHO.
disclaimer es, yo
So
voy
the
a
first
hablar desde el
disclaimer is I'm
caso
going to
de
speak
la gobernanza de una
from
institución.
the
Entonces,
governance
hay
of an
diferencias,
institution. There are
hay aspectos
differences,
a
of
tener en
course, and
cuenta. La
shades
pregunta
that
que
we
hacías,
should consider.
Marcelo,
Now, as for the question Marcelo was exposing. I think that it was quite good. The analysis that we've been doing and the work, and it's clear as a result of that work that even though AI is important, and not knowing
vida
of
y
AI,
nosotros
it's important.
éticas que
We need
necesitamos
to
de inteligencia
overcome.
artificial
It's there are
necesitamos
different parts of the
la inteligencia
fields of AI
artificial
that we
existe
should
en
know.
diferentes
AI exists
tamaños,
for over
diferentes
70 years
formas y
now,
funciones.
in different
Entonces,
forms and
lo primero
versions. So the
para
first thing
poner en
to
valor es que
uh,
desde que el
say
hospital tomó
is
una
that
decisión
since the
de
hospital
proyecto de
took a
sistemas de
decision of a
información
project
y en
around
ese caso
information system
tener
and
la
have been
inteligencia
trying
artificial como
to
una capa
implement AI as a new
Entonces,
layer
la
for
primera pregunta
continuous
que uno
improvement. The
haría es,
question perhaps that
¿qué es
you
el
can ask
enfoque
yourself
4?
is AI, which
Ahí
one?
yo les divido
I
el enfoque del hospital en cuatro grandes
talked to
periodos.
you,
Digo,
the focus of
cuando,
hospital in
cuando
4 big
inició el
areas in 5
proyecto,
years, in the beginning of
rápidamente
the
se
project.
sentaron las bases para lo
Quickly,
que se
the
llaman
foundations
sistemas
were laid
basados
down
en
for systems
conocimiento,
based on
donde
knowledge,
expertos basados en
uh,
reglas,
experts by
posteriormente la
rules, and
experiencia en
we
aplicar
have
reglas
gained a
con
lot of
registro
experience in
clínico para
applying rules in the
de alguna
clinical
manera
dossier
implementar
patients
al
and
profesional eso como
intervene
el
the
momento de oro, ¿no? El
professionals
momento
in
de
those
tomar la
golden
decisión
times or
y
hours
hemos
when the
logrado ya tener
decision-making
más de
process is
60
underway.
reglas con el
And
software
over
clínico.
60 rules
Eso
are
sigue
in place for that.
siendo
And that
inteligencia
continues to be
aplicada básico.
AI
Es una
pretty
inteligencia
useful.
artificial que no
It's
requiere
a
mucha
AI that does
capacitación
not
debido
require major training,
naturalmente se
given that
incorpora en el
it
proceso
was
asistencial y de
naturally
planificación
incorporated to
clínica.
the system
Sin
process
embargo,
and
en la
clinical
literatura hay
documentation.
mucha
However,
evidencia que
the
modifica
literature
tanto a
shows
expertos
evidence
de los
that
sistemas como a los clínicos de los pacientes.
doctors as well
Uno
of
podría decir
reactions
que
of patients
se
around
tendría que
this.
apostar
Perhaps you
a
can
una
say that
IA
today you
la que
want to
tiene
go
evidencia
for
y funciona.
AI, not the one has the most of
Luego
that.
atravesamos una segunda
We are
etapa, la
using. Now we
segunda,
went
los
into a
primeros
second
5 años del
stage,
proyecto, ya lleva más de
also
4,
5 years,
en donde aplicamos técnicas
where we
más
apply
que nada
the
procesamiento del lenguaje natural
techniques
y
for natural
reconocimiento del
language
habla,
processes and uh,
entendiendo que la
language
riqueza
recognition,
del sistema
understanding that the
clínico, el
richness
proceso
of clinical
narrativo,
institutions
era
when it comes to
una
the
fuente
narrative
invaluable de
was an
información para poder obtener
invaluable source of
información que
information
alimente
to
a
obtain
otro tipo
information,
de
to
algoritmos en
feed
donde
other type of
aparecieron
algorithms
el machine
where
learning y
the
las redes neuronales, el
machine
aprendizaje
learning
neuronal.
neural networks are
Esto
present.
dio lugar a la tercera
So
etapa y pusimos
that
un
gave
foco
rise to
muy
the third
fuerte en lo
stage.
que tiene que ver
Um,
con algoritmos que
Strong focus on
desarrollamos todos una revisión
algorithms that we
computacional
develop
y
ourselves,
se
uh,
utilizaron técnicas de machine learning
use
y aprendizaje
machine
profundo.
learning
Sin
and deep
embargo, luego
learning as
descubrimos
well.
que
However, I
post
must
pandemia
recognize
había
that
unas 15
in
líneas
post-pandemics,
propias
there were
para
about
desarrollar en
15
embeber y
lines to be
embeber
developed and embedded
redes neuronales para
in the
procesos
neural
más que nada de visión computacional
networks.
porque
Uh,
era un lugar
Part of the
fácil
company because it
dar
was an easy way
ingeniería
or way
secuencial
or a place
logarítmico, por
to
ejemplo.
replicate what
Sin
radiologists
embargo,
do,
post
for instance.
pandemia y con la aparición
However,
de la
after the
inteligencia
pandemics and with the
generativa,
appearance of generative
la
AI as
mayoría de
well,
ellos, por diferentes motivos,
most of
entre
them
ellos
for
la fuga de
different reasons,
talento
among
y porque
them the
consideramos que cada vez
losing
era
of
más
human
difícil
talent,
el
it was
entrenamiento y
even more and
validación de
more
estos
difficult, the
algoritmos
training
y
and
porque
validation of
los grandes
algorithms.
modelos de
And
lenguaje como
because the big language
GPT-4
models
la inteligencia artificial generativa
and
ya
generative
venía
AI
aplicando
was
ese estilo
arriving
de
to
iniciativa.
observe
Ahí
that
aparece
type of
la quinta
initiatives.
etapa,
And then we
en la
went to
cual
a
era la
fifth
parte
stage,
de la
where
inteligencia artificial
uh,
generativa aplicada al ámbito
generative
clínico.
applied
Tomamos ya post pandemia
AI
un
applied
desarrollo
to
muy
clinical cases.
cauteloso,
And we took
yo
a very
diría
cautious development in that.
no
I would
tan
say
apresurado, de
not
encontrar el mejor
Russian,
modelo que
because we
posibilitara
wanted to find
terminar
out what was the
un
bad model,
asistente conversacional
allowing
en el
to
ámbito
generate
clínico.
some of a
Creamos un
conversation.
chatbot conversacional,
We created
cuidando
that
mucho los
chat,
datos,
taking
más que
care of
nada por el
data,
valor intrínseco que tienen los
especially
datos
because of
para
the
el
intrinsic
organismo
value data have
artificial, sino también
for
porque los
the
datos
assistance
tenemos la
or health,
tutela y
and
la
because
guarda.
we
No
have the
somos dueños de los
oversight
datos, los
of
dueños de los datos son los
being
pacientes.
oversight. We are not the owners. The
Entonces,
owners of data are the
siguiendo un
patients
perfil
themselves.
muchísimo más
So that
cauteloso,
is a
el
more
desarrollo
cautious
de inteligencia
profile. The
generativa en diferentes
development
dominios
generative AI in
cambió un
different
poco el
domains
foco y ahí voy
change
a tu
the
segunda
focus, and
pregunta,
I'm going to
en
address your
donde
second question there.
me voy a circunscribir a los
If I'm going
procesos
to
de
stick
educación y
to the
capacitación del
education and
talento
training
humano
process of
en
the
la
existing human
organización
talent,
con
or that's the one
respecto a
that
las
existed,
nuevas
the organization
tecnologías,
respected these new
debo
technologies,
confesar que el
well, I
enfoque
must confess
de las
that the
tecnologías
focus
previas a
of
la inteligencia
prior
artificial a las
technologies, or
generativas,
AI,
fueron
to the
sustancialmente
generative new
diferentes.
ones were pretty different.
Diferentes por qué, y esto es un
Different
camino que estamos
why, and I
haciendo y
think
que
this
estamos
is a path that
transitando,
we are making, we
esencialmente
are
porque
traveling,
en
essentially
las otras
because in
implementaciones había más
during the other
transparencia
or
si bien
past
necesitas
competencies that were graded with transparency, even though some bias exists in transparent domain. With generative AI, that transparency is lost, and the mere fact that there is a possibility of error, formulation of questions as well, interpretation of the responses. Now we consider that the path to the implementation should be different. I would say that we have taken management of change logic that are even more cautious than the ones before, and pretty useful for the use of those tools. But we never had a courses for the use before. But we have undergoing short courses, not the learning of the tooling, but to put focus on the responsible use. Mere fact that there is um, uh, the it is wrong interpretation makes necessary to generate a contract for responsible use of the data, because these tools are going to be cognitive co-pilots, if you will, and will never be able to generate absolute automation. Now, the second dimension that I want to put forward here over the table, AI is going to increase disorder if you have that disorder on the baseline. And normally our assistant projects are processes that are uh, assistance processes that are out of control. So we need to be even more cautious in the incorporation of that in this. And not so much the responsible use or specific use, but to find the right need. We have put the focus on the assembly, that is to find and feel those places where there's a true need to provide cognitive assistance with using these tools. And that was quite good and fructiferous, because normally we took the normal path, uh, thinking on literature or thinking of who developed that technology and applying that without considering the true visualization of the need, individual need. And that, of course, means we need to work prepare patient. It's not a patient, is not a manager, is not the same a decision maker, is not any other staff working in the clinical, or not an auditor, or even a nurse. So we have taken the path of going and generating or working on the regeneration of punctual needs. And at the end, this process will yield a benefit, and working on the apps based on that path. And finally, the assembly of governance, institutional governance architecture, where the assessment of standard technologies is going to be a sine qua non condition, because it's not only for medical directors, or it's not going directly to IAT specialists. Um, um, there, as users, will not have the necessary tools to assess. And that is something that I consider crucial at this moment. More than to educate, to have a workbox, and to have a working team that can assess until the national institution organization are mature enough to assess. Thank you, Marcelo. And that's what I have to say
No,
and
muchísimas
share with you.
gracias, Daniel. Siempre
No,
un gusto
thank you,
escuchar.
Daniel.
Gracias entonces
It's a pleasure and luxury to
a
have
las
you.
dos y los dos panelistas que
And
tuvimos.
the two
Excelente. Gracias
speakers
de
that we had
nuevo,
before, quite excellent.
doctor Benjamín Puerta, por
Dr.
abrirnos
Benjamin
este
Puerta,
espacio. Natalia,
opening this
Johanna,
opportunity, Natalia,
comparto
Johanna.
aquí en
And
el
I'm
chat lo que
sharing
les
here
mencionaba
in the
el
chat
doctor
what I
Barbosa
was
para
mentioning
compartir
to
con
you
ustedes
before
también la
about Dr.
visión de nuestro
Barbosa, and to
director.
share the view of our
Solamente un
director.
segundo antes de pasar
Just
la
a
palabra, decirle al
second
doctor
before
Benjamín
we
Puerta
go to
un
Benjamin
mensaje también
Puerta,
como persona que
um,
lleva el tema de inteligencia artificial en
a
el país.
message
Es
for a
muy bueno
person
que
that is
sepamos
managing
aprender.
AI from the PAHO. Uh,
Hay dilemas,
there are dilemmas,
tenemos
yes, there are,
preocupaciones,
and
las
we have
hay,
concerns,
y así
yes,
de
there are.
obvios hay,
There are challenges, yes, there are challenges,
sin ninguna duda,
but
las
without
personas
any
que
doubt,
abracen la inteligencia artificial van a
persons that
tener muchas más
embrace AI
oportunidades
are going to
que
have
aquellas que no las
more
empiecen.
opportunities to
Y
move
si
forward than
queremos
those
que
that do not
este
embrace AI.
algoritmo sin
If we
sesgos,
want
entonces tenemos que
programs without
involucrarnos,
biases, now
tenemos
we
que
need to get
participar en
involved.
el
All we need to
entrenamiento de los
participate
algoritmos
in
porque tenemos
training
que cuidar
such
los
algorithms,
datos
and
que
we
van
need
a
to make
terminar
sure that the
alimentando
data
los
that
algoritmos
is
no
going to end
tengan
up feeding
sesgos.
the
No
algorithm
tenemos que esperar
don't
que la
have bias
reflexión
in
venga de
itself,
afuera.
not the
Tenemos que
solution to
involucrarnos.
come from
Así que
others. No, we need to
felicitaciones,
get
Benjamín y
involved,
equipo.
all of us. So
Muchas gracias a
congratulations,
todos los
Benjamin and
panelistas
team,
también y
and many
gracias por el
thanks for all
espacio.
speakers. Many thanks for being here.
Muchísimas gracias, Marcelo.
Thanks a
Agradecemos
lot, Marcelo.
a
We
nuestro
thank
moderador de esta
our
actividad
moderator of
muy
this
especial y
webinar,
también a los panelistas
and
que
also
nos han
the
dado
different
valiosas
panelists and
reflexiones sobre
speakers who
las
have
cuales
given us
podremos
valuable
seguir
reflections on which
conversando
we can continue
próximamente.
talking in near future.
Antes de concluir esta
And
actividad,
before
colegas,
we
quiero remitir un
conclude
especial
this,
saludo
I
para todos
want to send a special
de
greeting
parte
to all
del
of you on
ministro
behalf
del
of the
Departamento de Salud,
Director
James
of our
Fitzgerald,
department, James
director del
Fitzgerald,
Departamento de Sistemas y
Director
Servicios
of Systems and
de
Services
Salud de la
Department on
OPS.
Health
Él ha
of
estado involucrado en
PAHO.
esta
He
actividad
has
desde el
been involved
inicio y ha
in
estado
these
dando
activities
seguimiento y
from the very
lamentablemente
beginning,
hoy no
following
pudo
up,
estar presente,
and
pero es
unfortunately today he
constancia de
couldn't be
su
with us.
interés y de su salud
But
y
I'm
para
going
todos
to leave
ustedes.
evidence of
Para
interest and
concluir
greetings for
entonces,
all of you.
colegas,
Now to
llegamos al
conclude,
cierre de esta
dear
actividad.
colleagues, we are
Rápidamente
reaching the end
invito
of
al
this
doctor
activity. I'm going to
Benjamín
invite
Puertas, el jefe
Benjamin
de la unidad
Puerta,
de
the
recursos
head
humanos,
of the Human
para que nos
Resources
dé
Unit,
sus comentarios de
to
cierre de esta
give,
actividad.
to
Doctor
have his
Puertas, por favor,
comments.
adelante.
Dr. Puerta, the floor is yours.
Muchísimas gracias, Joana. Muchísimas gracias,
Many thanks,
Marcelo, y a
Johanna.
todos
Many
los
thanks,
panelistas.
Marcelo team, and
Qué
all
recorrido
panelists and
que hemos
speakers.
tenido el día de hoy.
What a
Solo
wonderful journey
dábamos los
we've
datos
had
de evidencia.
today.
Han
Could
sido
be here
menos de
for
2 horas,
hours.
pero hemos
Well,
podido
we have
recabar
been
una
here for
gran
less than two
cantidad
hours,
de
but we have been able to
información,
collect huge amounts of
desafíos que van
information, and of
apareciendo.
course,
Hemos visto
knowing
la
the
mirada
challenges that are
nacional,
popping
hemos
up.
visto
We
una
know
mirada
we have
regional con la
seen
competencia de
regional
analizar el
views
impacto
and national
y hemos
views as well,
terminado con una visión
and we have
institucional,
and with an
ya
institutional vision as well,
específicamente mirando cómo la
specifically
inteligencia
looking
artificial
at how
está ya
AI
incidiendo
is
en el
already
trabajo con el personal de
impacting
salud de una
the
institución
work
en particular.
of
Es
the
decir, un recorrido
health
que ha cumplido
workforce.
todos
Has
procesos en los cuales la
uh,
inteligencia
met
artificial
all
puede y debe estar
processes
involucrada también de
where
forma
AI
efectiva.
should be
No me
involved.
queda más que
It's not nothing
agradecerles a
else to
todos y todas
say.
los que
Well,
hayan
just
venido.
to
Hemos
thank you, all
tenido
of you.
casi
Um,
prácticamente todo el
Look
grupo
that we have
de personas,
almost the
amigos, amigas del
entire group
continente
and
que han estado
team
desde un inicio muy
all,
formal, un promedio de 500 personas.
from all the corners of the continent,
Y luego
um,
estaremos compartiendo con
and
ustedes de
we
qué
will be
países han
sharing with you
estado, pero
later on
seguramente vamos a
what
tener una
countries will be present. But
representatividad muy
surely
grande de todas nuestras
we are
subregiones,
having a big
Norteamérica, Centroamérica,
representation
Sudamérica y
from
el Caribe.
North America, Central
Para
and
la
South
Unidad de
America.
Recursos Humanos para la
For the
Salud del
Human
Departamento de Sistemas
Resources
y
Unit
Servicios de Salud
and
de la OPS, ha sido un honor
Services
realmente.
of PAHO, it's been an
Como
honor for
miramos a
me
los
to be here.
próximos pasos, hay
As
muchos
we were
pendientes.
hearing,
Yo creo
there
que en
are a
este
lot of
momento,
items, action items
solamente por
pending.
escuchar a ese
Just
distinguido
by
grupo de panelistas
listening
que nos
the
han acompañado
distribution
hoy,
group and panel,
ya me han surgido una cantidad de
I have a lot of
elementos,
elements in my
posibilidades de
mind,
trabajo en conjunto,
possibilities to
establecimiento de
work
redes,
together, the
seguramente
establishment
Marcelo
of
igual.
rules. And surely Marcelo
Y
has
eso,
the same
tengan la seguridad de que la
opinion,
OPS va a
but
continuar
be sure
interactuando
that
con
the PAHO
ustedes
will continue
porque lo que
interacting with
en
you
cada uno de sus países, sus
because
instituciones están
your
haciendo
different
es
countries, different
fundamental para el
institutions are
avance
doing
de
is
la
fundamental
transformación
for the
digital y en particular
progress of
teniendo en el
digital
centro
transformation,
a las
especially having
personas
in
no
the middle
participantes.
the
Así
human
es que
resource.
muchísimas gracias de
So
nuevo,
many
de
thanks
nuevo,
to all of
a todos
you.
los participantes,
Once
a
more,
todas las
thanks to all of
participantes,
you,
a ese
dear
destacado
participants,
grupo de panelistas que
and
nos
to that
acompañó hoy, a
outstanding
nuestro
group of panel
moderador Marcelo
speakers
Agustino,
and
realmente ha sido
moderator Marcelo
un
Agustino.
cariño y un
Special
agradecimiento
greetings to you and
muy cordial.
appreciation for your
Joana
work
Díaz, nuestra
in this webinar.
moderadora, Natalia, nuestra
And also
captadora
to
principal,
Natalia, our main
y
researcher.
vamos a tener una siguiente
We'll be having
otro
a
espacio donde ya presentaremos el modelo
another
predictivo y
opportunity where
seguramente
we will
será de
be
mucho interés para
introducing the
todos y todas
predictive
ustedes.
model. That will
Muchísimas
surely
gracias
will
y
be
hasta
of
pronto.
interest to all of you. Many thanks and see you next time.
Hasta luego.
Muchas gracias, estimados colegas. Hasta la
So
pronto.
many thanks, dear
Buen
colleagues.
resto de jornada.
Yeah.
Gracias,
Have a
gracias.
nice day. See you next
Thank you
time.
so much.
Goodbye.